today we are bringing a very new type of the session for you. Hello friends, my name is Dr. Jesal Seth. I am working as a pediatrician in Fortis Hospital, Mulund. Today we are going to do something new type of the session for you. So many parents, they meet us and they ask so many questions and what to do about it. So today what we did, interestingly, we looked at so many commonly asked Google questions, and today we are going to actually look into a few questions and trying to answer that. So let me look at the first question. So one of the commonly asked Google question is, why does my toddler still drools and why can't my kid sit still? So friends, the toddlers continue to drool. It is actually normal for the most of the cases, but if you see that your toddler is actually drooling in the night particularly, and along with that if there is an obvious noisy breathing sound, we need to investigate for some of the medical problems like some kind of the big turbinates in the nose or the adenoids or a large tongue. But normally if the kid does not have any symptom and a kid continues to drool, there is no problem with it. Why does my kid cough? I think cough has bothered all the parents a lot in last 6 months. Coughing can be because of infections as well as allergies also. Why does my kid cough when he runs? If your child is, particularly start coughing after the running, it is possible that your child is suffering from exercise-induced asthma. So people get very scared when they hear the word asthma. It is one type of the allergy, and it is absolutely, we can give good medications to relieve all the symptoms and better control. So the question is, how do I know if my child has the worms? So friends, if the children have worms, they come out in the anal region, in the stool. Sometimes you can see it when the child is sleeping in the diaper. You can also see child itching repeatedly the anal area. Sometimes you see little soreness around it. Other question I have is, why my toddler is telling that the stomach hurts? Friends, children can be many. Toddlers, they normally do not complain verbally if the stomach is hurting. But if they are complaining that the stomach is hurting, that means stomach is hurting. The other question is, why my child is always sick? I think children are not always sick. So many times when they come to us, actually we ask, is it a single sickness for which child is suffering, or the child was unwell, recovered, again became unwell and again recovered? Why does my kid always wake up crying? I think no kids actually should wake up crying. So if the kid is, waking up with a cry, we need to again, look into the multiple, reasons, starting from some kind of the psychological reasons where child is scared when he is not finding anyone, in that room, or child is having some kind of the stomach pain in the night, child who is hungry, or child is not well, or child who is not able to sleep properly in the night. We see so many times small children suffering from the sleep disorders where they are not able to sleep sound in the night in one stretch, and that's why they are not fresh in the morning. So kids should not wake up crying. Of course, kid will learn to say good morning all the time, but if the kid is waking up and crying every day and really uncomfortable even after you go and soothe the kid, then we need to actually really assess the child and see why this problem is happening again and again.